Hello, my name is Christian DeGrafton-Reed. I'll be performing a physical assessment on my fiance. Thank you. Is that okay?
You might want to tilt it that way. There you go.
Okay. Hi, my name's Christian. I'm going to be your nurse today. I'll be performing a physical assessment. How are you?
Good, how are you doing?
Can you confirm your name and date of birth for me?
June 18th, 1992, Ethan Wagner.
All right. I'm going to go, I would wash my hands now before I perform the physical assessment. I'm going to pull the curtain and provide privacy. And can you tell me what day it is?
February 17th, 2019.
And where are we at?
Jitsonia, Arkansas.
And who's the president?
Donald Trump.
Can you tell me what we're doing here today?
A physical assessment.
All right. So my patient is alert and oriented ×4. He is sitting back, relaxed on the couch, hands in lap, laced together. He has a smile on his face, and his appearance is he is dressed appropriately for the weather and for the situation, and he is pleasant and cooperative during this physical assessment for me. Speech is appropriate. Now I'm going to go into the physical assessment. I'll start with his head. I'm going to palpate your head. Just tell me if there's any tenderness or anything, okay?
Okay.
You feel anything?
No, ma'am.
Okay. Head is normal cephalic. No tenderness or pain noted. No masses. No lesions. No exudate. No exudate noted. Face is symmetrical. No lesions or masses on his face. I'm going to have you take off your glasses, okay? Conjunctiva or clear, sclera is white. Eyes, pupils are about 4 millimeters. Resting. And about 2 millimeters constricted. You can put your glasses back on if you want. I'm going to have you look up. Nares are patent. Mucosa is pink and moist, or pink and dry. There is no exudate. There's no, I'm going to have you look it up again, okay? There is no exudate, no masses, no lesions noted. Can you look at this wall for me? Okay, and look here. Okay. Eyes are equal in accommodation. Dilate when looking at near objects and converge. I'm going to have you smile. Teeth are straight and white. Say ah. Tonsils are 2+. You can close your mouth now. Tonsils are 2+. Uvula is at midline. Tongue is at midline. Mucosa and gingivae, go like that again, I'm sorry, are pink and moist. No exudate, no lesions or masses noted. I'm going to go through your respiratory assessment now, okay?
Okay.
Chest is symmetrical, no appearance of masses, no lesions. Chest rises and falls with inspirations and expirations. Let me get my stethoscope. I'm gonna have you kind of scoot up and yeah, facing the camera that way. Yeah. I would auscultate lung sounds starting posterior, then go anterior. I would down. I would go through the 9 spots on the back and then the 5 spots in the front. I'm gonna have you take a deep breath every time I move my stethoscope, but I'm not gonna do that for this purpose because I'm gonna be going a little faster. 1, 2, 2, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8, 9, 9. Okay, you can put that. Posteriorly, all lobes are clear, equal bilaterally. No adventitious lung sounds noted. Now I'm going to go through anteriorly and auscultate. Going through the 5 spots. 1, 2, 2, 3, 4, 5, 5. Lung sounds anteriorly are clear and equal all lobes. All lobes in the back as well. Now I would start on his cardiac assessment, starting with palpating his pulses. I would start with the carotid, but I would do this on both sides. And for the carotid, I would do it one at a time. For the rest of the arteries, I would do them at the same time so that I could compare them. And carotid is 2 plus. Equal. Brachial is 2 plus. Radial is 2 plus. I'm gonna have you lay back, okay? Femoral is 2 plus, and dorsalis pedis is 2 plus. Again, I would compare all of these, to the opposite side and compare symmetry. I would then inspect his upper and lower extremities. I'm looking for any varicosities or edema. No edema is noted in the upper extremity, no varicosities either, and none noted in the lower extremities. I would compare this bilaterally to the opposite side. Nails are smooth, pink, dry. Cap refill is within 3 seconds for the upper extremity, and nails are smooth, pink, and dry on the lower extremity, and cap refill is within 3 seconds. I'm going to perform your abdominal assessment, okay? So I would, the abdomen is symmetrical, it is slightly rounded. There are no visible lesions or masses, wounds noted. I would then auscultate starting in the right lower quadrant, going through all 4 quadrants. Bowel sounds are normal, active, all 4 quadrants. I would then palpate. Let me know if there's any pain or tenderness, okay?
Okay.
Is that alright?
No pain.
No. I didn't palpate any masses. Patient reports no pain or tenderness. I'm gonna have you sit back up, okay? When I was doing his cardiac assessment, I skipped over auscultation, so I'm gonna perform that right now. Okay. Now I'm going to perform. The musculoskeletal part of his assessment. I'm gonna have you squeeze my fingers, okay? And when I push, I'm gonna have you push back, and when I pull, I'm gonna have you pull, okay? I'm gonna do that for both your hands and your feet. All right. So push, pull, and push, and pull. Okay. Strength is adequate for resistance. Strength is adequate for resistance. I'm going to go through the sorry, my low battery came on. I'm going to go through his range of motion. I'm going to have you adduct your arm. Alright, and abduct. And I'm going to have you extend your elbow and flex. And I'm going to have you do that for this hip and back. And now your knee, I'm going to have you, and back. Okay, no crepitus noted. No pain or tenderness reported by patient. Full range of motion, and I would check all of those bilaterally and compare for symmetry. I'm going to have you stand up, and can you just, let me move this pillow. Can you walk over there and back? Whoops. Okay, sit back down. Gait is smooth. No notice of shuffling or unbalanced. I'm gonna go through your skin assessment now, okay? Skin is pink. Okay. Skin is pink and dry. Arms are slightly freckled. No wounds. No wounds noted. Bony prominences. No redness noted. Do you have any wounds that you know of? Okay.
No, ma'am.
And no scars or anything?
No, ma'am.
Okay. Heels, I would check all bony prominences, heels, tail bottom, knees, bones, or heels. All are fine. No redness, no edema, all blanchable. Now, that would be the last thing that I would inspect on him. I would go through a breast assessment. I would start by inspecting for any dimpling, any swelling, masses of any kind, any skin discolorations. Then I would observe the patient with arms above the head, at the hips, palms together, and then palms together leaning forward. I would then palpate in a vertical strip pattern, and I would pay special attention to the axillary telesponts since that is where most cancers are found. My name is Christian DeGraftenraid. Thank you for watching this video. I'm very sorry about my animals because I could not get them to be quiet. Thanks.